Hello, and welcome to the Supporting Patient Affordability and Convenience Showcase here at HIMSS 2023. My name is Travis with Oracle Health. I'm here with Marissa and Teresa from Arrive Health. Together we're going to go through and provide a live demonstration from the vantage point of a prescribing provider and our patient Maeve Breckenridge. But first, we want to highlight our respective organizations.
Arrive Health is a health system-owned price transparency company within the e-prescribing workflow. We help a provider know how much a medication is going to cost so they can make a more informed prescribing decision. We're excited to share how we're driving prescription affordability and convenience through our new enhancement.
The Oracle Health portfolio of interoperability solutions helps providers connect with patient data that lives outside their organization's EHR. In partnership with Arrive Health, we've equipped our real-time prescription benefit capabilities with the ability to prescribe low-cost drug alternatives at the prescribing provider's in-house pharmacy.
We know that two of the greatest barriers to medication adherence are cost and convenience. You've probably heard of or experienced a time when you showed up to the pharmacy to pick up a prescription and it was more expensive than you thought it was going to be. This can cause a sticker shock moment, and oftentimes the patient will actually walk away from the pharmacy without picking up their prescription. Secondly, studies have shown that once a patient gets to an appointment, their ability to get to a second location, such as a pharmacy, actually goes down. These issues are only compounded when a provider has to make a treatment decision without the information at the point of prescribing. So to create a better patient experience and outcomes, we've worked together to be able to show real-time, low-cost, and convenient prescription options. Over to you, Travis.
So we're going to meet Maeve. Maeve is a 38-year-old mother who works a full-time job and helps care for her elderly parents. As a small business owner, Maeve is realizing that she's struggling with increased levels of stress and anxiety, but hesitant to get help, partially because of the time it takes to reach out and have a doctor's visit, but also because she's afraid she might not be able to afford the medication that may be prescribed. Unfortunately, it's reached a breaking point, and Maeve reaches out to her primary care provider. Maeve schedules a visit with her primary care provider, Dr. Callahan. Upon admission, Dr. Callahan briefly checks over Maeve's demographics. She checks in her insurance, and then looks to see if any outside records have pulled in from other organizations. Here, you will note two problems that pulled in through Commonwealth, one noting a swallowing problem that Maeve has experienced in the past. After Dr. Callahan and Maeve's discussion, Dr. Callahan decides she's going to provide a prescription of fluoxetine to Maeve. Noting the swallowing problem she's had in the past, she talks to Maeve about this issue, and Maeve is relieved that Dr. Callahan was able to see this past medical information to help relieve some of that stress. Dr. Callahan is going to submit the prescription, and then she is going to be presented with a few options for the fluoxetine. Here you will see the first prescription is at Maeve's local pharmacy, which is across town. Maeve does not have time to go to this pharmacy during her busy schedule. So Dr. Callahan is also provided with two no additional cost prescription options, one being at the in-house pharmacy. Here, Dr. Callahan will select the prescription at the in-house pharmacy, and I'm going to turn it over to Marissa to show what's going on behind the scenes.
So the Arrive Health network is set up with a direct data feed from multiple sources. So you can see on the left-hand side, we have multiple pharmacy benefit manager and payers that we connect up to. We also connect up to discount drug card programs and coupon and copay assistance programs. And lastly, we can also directly connect, as Travis spoke about in the demo, with the hospital's direct pharmacy network. This enables that real-time connection with the providers to see additional information. From there, our Arrive Health intelligence layer normalizes all of these data points together to provide the most affordable options for providers when they have the patient at the point of care. And so how the fulfillment optimization works is the inputs are configured to really focus on multiple different types of medication types for patients, including acute, specialty, and chronic medications. And then we can also focus on various pharmacy locations that can be configured: mail order, retail, specialty, as well as 340B pharmacies. It can be configured to align with your pharmacies while keeping the provider and the patient at the forefront, so that we're always providing the lowest cost option to create that affordability, but also the convenience to stay within the in-house pharmacy. So as you saw in Travis's demo, through this interoperability with the EHR, Dr. Callahan saw Maeve and initiated a new drug regimen for Maeve on fluoxetine. Dr. Callahan was able to order her prescription and was able to view in real time what the cost and pharmacy options were through the Arrive Health Network connections. Dr. Callahan and Maeve were able to talk about these options and make a decision together. Then he sent the prescription down to the pharmacy within the health system, and she left with her prescription that day after her visit. So this focus is all about helping the provider find the affordable and convenient medication options for their patients. So now we have a way to help health systems solve prescription affordability and accessibility issues and really support the health system's growth initiatives, all while keeping the patient at the forefront. Back to you, Travis.
Now Maeve can see that her prescription in the Oracle Healthy Life patient portal. With the knowledge that fulfilling her prescription at the in-house pharmacy carries no additional cost to Maeve, she walks down the hall with a peace of mind, saving time and money during her hectic schedule. Thank you.
Thank you for your time.